Hello, I'm Larry Gifford. I'm a member of the Michael J. Fox Foundation Patient Council and the host of the podcast When Life Gives You Parkinson's. I also host the live Parkinson's IQ plus U events for MJFF. These are free informational and educational events that we've conducted in Atlanta, Anaheim, and Phoenix. Before we had to postpone it because of COVID-19. And now we're bringing some of this great information, the same style of information education to you for free here online. Thank you for taking time today to be with us today. Last week, I had my regular checkup with my neurologist, the difference being we met on Zoom. He was in his house, I was in mine. It was the first experience with telemedicine for me, thanks to coronavirus, and a lot of us are now experiencing that for the first time. So today, let's learn the ins and outs of telemedicine, what to expect, how to prepare, and why it might just become your preferred method of seeing your movement disorder specialist. You can submit your questions in a Q&A box near the middle of your screen. Just type your questions there, and we'll do our best to get to as many as we can. You'll also find today's slides to download and also some other helpful information in a box called Resource List on your screen. I suggest you take a look at that. I know we have a lot of questions these days, and in that resource box, there's some great information. We also want to take a minute to thank our sponsors. Today's session is brought to you by Acadia Pharmaceuticals, with support provided by Voyager Therapeutics and additional members of the Parkinson's Disease Education Consortium. The Parkinson's Disease Education Consortium members share the Michael J. Fox Foundation's commitment to providing high-quality educational resources to the Parkinson's community. They support many of the Foundation's great resources, including webinars, podcasts, videos, and website content, along with in-person events. A list of resources will be provided at the end of today's session. Now today, our goal is to learn more about telemedicine and its use for Parkinson's disease, hear from experts on how to get the most out of virtual doctor visits, and understand how to manage Parkinson's during the coronavirus epidemic. Now, what we talk about today will be helpful for a telemedicine appointment with any of your doctors, but it's important to understand the differences between the different kinds of doctors that treat Parkinson's, starting with movement disorder specialists. In a survey conducted by the Michael J. Fox Foundation, less than half of respondents know what a movement disorder specialist is. And simply, a movement disorder specialist is a neurologist who has additional training in Parkinson's. And we're lucky enough to have two of them with us today. But before we get to the introductions, we're going to play a brief video that's part of the live Parkinson's IQ plus U events to help explain a little bit more.
I'm Dr. Rachel Dolan. I'm a movement disorder specialist and Vice President of Medical Communications at the Michael J. Fox Foundation for Parkinson's Research. A lot of people with Parkinson's don't even know what a movement disorder specialist is, and many people don't even get care from a movement disorder specialist. A movement disorder specialist is a neurologist who has additional training. We've spent extra time on top of our training learning about Parkinson's, learning how to recognize the signs and symptoms of the disease, whereas a general neurologist may see about 10 people with Parkinson's a month. A movement disorder specialist might see that amount of people with Parkinson's in a day. Movement disorder specialists can help you come up with an individualized and personalized treatment plan. People who see a movement disorder specialist typically report feeling more informed about their care and feeling more empowered about their care. Movement disorder specialists can be hard to find in some areas, but there are many ways to find them. You can ask your primary care physician or your neurologist for a recommendation. You can also look online, or you can ask other people in your community who they see. Ideally, we'd like you to see a movement disorder specialist when you're diagnosed with Parkinson's, but any time in the course of your disease is a good time to see a movement disorder specialist. You can find more information about movement disorder specialists in my Ask the MD series of blogs and videos. I hope that this introduction was helpful, and you'll learn much more today, throughout the day, and on our panels.
Excellent. Now I would like to introduce our panelists. Ray Dorsey, MD, MBA. Dr. Dorsey is a leader in the field of telemedicine in Parkinson's. He is the David M. Levy Professor of Neurology and Director of the Center of Health and Technology at the University of Rochester Medical Center. He previously directed the Movement Disorders Division and Neurology Telemedicine at Johns Hopkins University. Dr. Dorsey, thank you for being here.
Thanks very much, Larry.
Jamie Martin, doctor, PhD, is a movement disorder specialist. While on the faculty at Emory University, she started a telemedicine clinic for patients with movement disorders. She currently works for SOC Telemed and has her own company, Face to Face Neurology. Dr. Martin is on the International Parkinson's Disease and Movement Disorders Telemedicine Task Force and serves as the telemedicine expert of the American Academy of Neurology's Practice Management and Technology Subcommittee and Emergency Telemedicine and Telemedicine Reimbursement Work Groups. That is a mouthful. Dr. Martin, thank you for being here.
Thanks so much, Larry.
And I also want to introduce Christy and Prentice Brooks. Prentice and Christy are originally from Colorado. After 7 multi-state moves, are happy to call Arizona home. They've been married 32 years and have a daughter in Ohio and a son and daughter in California. Christy was diagnosed with Parkinson's in 2013.
Thanks, Larry.
And we're glad to be here today.
We're going to start with the very basics. What is telemedicine? And for that, let's go to Dr. Martin. Can you explain what telemedicine is?
So, Larry, telemedicine is really the remote delivery of any kind of care, either over the telephone or via any kind of technology, video, or, just these regular doctor's appointments that we've been talking about from home using your smartphone or computer or some other sort of electronic device.
Great. And now, Dr. Dorsey, you've been doing this. You're like a trailblazer in this field. You've been doing this for over a decade. Why did you get started with it? Why is this a good thing?
Telemedicine offers 5 C's. 1, it reduces contagion, critical today in the COVID pandemic. People can get care without getting exposed to a coronavirus. 2, it offers care to people regardless of who they are, where they live. 3, it does it conveniently in somebody's home without them having to travel or wait. 4, it's in the comfort of their home. And 5, it's in confidence. You can actually have more confidentiality about your disease or condition when you do so via telemedicine.
5 C's. I like that. Now, how has telemedicine evolved? I'm sure you've seen it evolve quite a bit over the last decade to where we are today. What have you noticed?
So Dr. Jean Hubble started doing telemedicine in Kansas in the 1990s because a lot of her patients were driving 2, 3, 4 hours to see her, and she thought there could be a better way. But even though there have been trailblazers like Dr. Jean Hubble, it's been a relatively niche operation, although Dr. Hatcher Martin and others are trying to make it more common. And then we've had more change in the last 4 weeks regard to telemedicine than we've had in the preceding decade. And right now it's standard of care. People like you are receiving care via telemedicine. People like Mr. and Mrs. Brooks are getting care via telemedicine. And all of us are getting, many doctors and many patients are getting their first exposure to it right now.
And that's interesting. So we talk about the coronavirus and how it's changing things, and now we're now meeting our doctors online. Do you see that as sort of a big pivot point for telemedicine? Do you think this remains even after coronavirus?
So that's a great question. Is the genie out of the bottle? I think to some extent it is. Many of the changes that have enabled the use of telemedicine are temporary. So the Center for Medicare and Medicaid Services made policy changes that allowed, 1, coverage of telemedicine in the home for Medicare beneficiaries, 2, reimbursement for that care on par with a clinic visit, And 3, there have been some licensure changes that have enabled more people to gain access to telemedicine. These changes are temporary. They will need to be made permanent, many by congressional action, in order for people to continue to be able to receive care conveniently via telemedicine.
Are there a lot of government regulations around this yet about, can you see patients in other states or other countries by telemedicine?
Yeah, so generally speaking, pre-COVID, people with Parkinson's disease were limited to seeing specialists in their state. So I looked at Mr. and Mrs. Brooks. I think they've had 7 moves and have moved to many different states. So if they move states, they have to find a new doctor every single time they move to a new state. They got to find a new specialist for their Parkinson's disease. In the setting of the pandemic, many states have waived those restrictions, so people can see physicians from other states. But those changes are, again, largely temporary, and we need to make sure that they're permanent so people can get care regardless of who they are, where they live, or where they move to.
Now, how do healthcare or health insurance companies differentiate between whether you see your doctor in person or you see them through your computer?
So Medicare, which insures about 97% of individuals with Parkinson's disease, made huge distinctions pre-COVID. They paid about $200 to see Dr. Hatcher Martin at Emory, where she used to be, or to see me or my colleagues in the clinic at Rochester. About $100 if they got seen in a community-based clinic, and $0 if they got seen in their home via telemedicine.
Wow.
So that's why we didn't have. That's why we didn't have much. Exactly.
Yeah, I guess.
And now they pay about $100 for a follow-up visit via telemedicine. But it's kind of odd that Medicare, funded by taxpayers, incents care to be provided in expensive institution-centered settings instead of inexpensive patient-centered settings.
All right, so some work to be done maybe after all of this is over. Let's dive into what a telemedicine appointment looks like. I'm going to pivot away from Dr. Dorsey right now. We have a short video. Christy Prentice and Dr. Martin sort of give us a 360 perspective on what a typical visit could look like from the perspective of a patient, a care partner, and the movement disorder specialist. Let's go to that video now.
Hi, Mr. and Mrs. Brooks. How are you doing today?
Hi, we're doing well.
Hey, we're doing really well too.
It's really good to see you. So, normally if you were a new patient, I would introduce myself. I'm Dr. Jamie Martin, and I would have you both introduce yourselves, and Mrs. Brooks have you give me your date of birth. But since we know each other and this is just a checkup visit from our last time, we don't have to go through all those formalities, okay?
Okay.
So tell me a little bit about what's going on. How have you been for the last few months?
Feeling pretty good. Sleeping well. I'm still working full time.
Good.
Trying to get some exercise in here and there.
Okay. Any particular concerns today?
The only thing that I want to talk to you about is that I started a boxing class, and it's after work, and I feel like maybe I need a boost in my medication before, so I'm more coordinated during boxing class.
So what time are you taking your medications right now?
Usually I was taking it at noon and then at 5, but my boxing class, I leave at work at 4. It's almost like I need to just, increase the medicine or take it early.
Okay. We can certainly talk about that. Do you feel like it's starting to wear off at that point, or do you just feel like it's just not quite enough to participate in the exercise class?
It's just not enough I just don't feel like I'm at my best in boxing class.
Okay, we can talk a little bit about that. We might be able to either increase your dose or maybe take another half tab right before your exercise class to see if that can help kick in.
Thank you.
Any other particular concerns today?
No, I don't have any.
I just have a few questions that I'm sorry, were you going to say something?
I was just going to say that I would agree with her, because when she comes home, she says, my brain just can't think about how I want to do those exercises that the instructor is asking her to do.
Okay.
So that confirms that her meds are quite on.
Okay, great. What about any other time of day? Do you feel like that medications are not quite enough or wearing off?
No, I'm good.
Okay, and how about overnight? Do you feel like you're getting through the night okay? And when you wake up, you feel okay? Okay.
I pretty much go to bed and go to sleep and wake up at 5 o'clock in the morning. So yeah, it's good.
Great. And any falls since your last visit?
No.
Okay, great. And any changes in thinking and memory?
No, I'm good.
Okay.
I'm still like, in meetings at work, I'm still like, am I the one thinking and coming up with solutions? And sometimes that's this case. I'm like, okay, I'm still working, you know.
Okay, good. Any side effects from any medications? Any upset stomach or queasiness or anything?
No, I'm used to it. Thanks.
And feeling lightheaded at all?
If I get up fast,
Okay.
I kind of have to let my head catch up with it, you know.
Right. Okay, so we'll just have to keep an eye on that, especially if we end up adjusting your medication a little bit, because that can always make that a little bit worse. We just have to really keep a close eye on that, okay? So what we typically do with the exams is just like in clinic, we'll do basically all of the same things that we would do. The only things we can't really check are the tone, right? When we check to see how stiff your arms and your legs are. We can't do that with the telemedicine. And then, normally we do that, everybody's favorite part, right? The pull test at the end of the exam. We will not do that today. But I would like to do, typically I like to be able to see kind of all of you for part of the exam. So at one point I'll have you back up so we can kind of watch everything. But always kind of during this part, and we'll do some of the finger taps and things like that. We'll do all that up front because it's easier to see when you're kind of up close for that. And then if you have some room, then we can have you move back. And it looks like you might have some space maybe where, I don't know if we can adjust the camera, or if this is a mobile camera, if you can maybe walk up and down a walkway or a hallway or something like that. Okay, great. Okay, so the first thing I want you to do is, let's see, why don't we do, we'll do the stuff up close first just to make it a little bit easier, okay? So the first thing I want you to do is take your right hand and take your thumb and your pointer finger for me and just tap, tap, tap. Try to go big and fast for me. Good, and then how about the left side? It's a little bit harder there.
Yeah, it is.
Okay, and then so with both your hands out, can you open and close both hands for me? Good, and then how about just the right one? Good, and then how about the left one? Okay, and then put both hands out in front of you, and I want you to flip your hands back and forth for me. Good, and then hold your hands out in front of you again. Good, and then cock your wrist back for me a little bit. Good, and then down like this. Okay, and so we can do the next part one of two ways. Typically, if it was just you by yourself, I would have you do it this way, so let's try this. Can you put your left hand out in front of you with your pointer finger out? And with your right hand, I want you to touch your nose, and then touch your finger and go back and forth. Good, and then switch sides for me. So hold your right hand out and go back and forth for me. Perfect, okay. And then let's see, if we can have you maybe back your chair up a little bit. I'd like to be able to see your feet, if at all possible. Keep going, keep going. Is it possible to just tilt the camera down just a touch? There we go. And if I can have, Mr. Brooks, if I can have you just kind of swivel your chair, there, perfect, just like that. So what I would say is ideally, we always want to be careful about the rolling chairs because it is a little bit of a fall hazard. So we'll just be really careful with this, okay? So right now what I want you to, we're kind of doing things a little bit out of order so you didn't have to go back and forth. So let me just have you kind of sit back in the chair, put your arms on the arms of the chair, and just let your hands relax kind of in the front. And let me have you come just a little bit forward now since we moved the camera down. Okay, right there's perfect. Let your arms just kind of relax on the arms of the chair. Let your hands dangle down. Close your eyes for me. Okay, and then can you say the months of the year backwards for me? So December, November.
December, November, October, September, August, July, June, May, April, March, February, January.
Great. And then the next thing I want you to do is with your right foot, can you stomp your heel up and down like you're stomping on a bug? Good, and then switch sides for me. Okay, and typically in this situation, I would actually have you cross your arms and try to stand up from the chair, but because it's a rolling chair, I'm not gonna actually ask you to do that today. So can you just stand up from the chair for me and you can push off the arms? Okay, and then do you have maybe if we can either move that chair out of the way, if we could just watch you maybe walk down towards your door and back. Good, that looks great. And then maybe one more turn and back, all the way down and back. and turn around and come back. Okay. And then before you sit down, if you could just kind of turn and just kind of face towards the left for me. So just kind of look straight ahead. Turn just a little bit more towards your left. That gives me kind of a good view of your posture. Okay, you can have a seat. Okay, so obviously we made a little bit of modifications to the exam, but we were able to get all of the information. So I think, as long as you're tolerating the medications okay otherwise, and there's no other major wearing off of medications or any major side effects, we could try one of two things as far as your medications go. With them, not being quite enough for your afternoon exercise, the boxing class, which I think is a great thing to do, by the way. So we could try one of two things, and you can kind of play around with it and see what works out best for you. You could either try increasing your 12 o'clock dose. So let me ask you this, do you feel like between, let's say, 12 and 4, do you feel like your meds are okay, or do you feel like it's kind of wearing off at that point?
It's definitely by 4 o'clock, it's wearing off.
Okay. So what I would say is, just to make life easy, is maybe start by increasing your 12 o'clock dose by maybe a half of a tablet or maybe even a full tablet, depending upon how things are going. And it may be, if you're not exercising every day, you could consider trying it just on those days that you exercise. You can kind of play around with that a little bit and see how that goes. If that's enough, great. We'll just leave it there. We'll just increase that 12 o'clock dose. If you feel like it's still not quite enough for your exercise time, then maybe we take that half or that full tablet and we move it to, maybe 30 minutes to an hour before your class to kind of give you that little extra boost, and see if that helps kind of get you through that class time.
Okay, I will do. Thank you.
Yeah, any questions for me?
No, I'm good with that.
And Mr. Brooks, any questions?
No, I think that sounds like a very good approach, for her to be able to go to her boxing class and get the most out of it. And so we'll be anxious to see how she does after.
Absolutely, I can't wait to hear about it. So what I'll do is I'm just going to write down some instructions for you, and we'll get those over to you so you have a little summary of everything that we talked about, and we'll get you set up for the next appointment, okay?
Okay, thank you very much.
So great to see you both. All right, take care. Bye-bye.
Okay.
All right, you too.
Bye.
Oh, well, that was great. How awesome is that? And I should note that there's a lot of information coming at you today, and this presentation and these videos are going to be available the next, like 2 days, next 48 hours, on the michaeljfox.org website. So if you want to go back and take some more notes, or if you had trouble viewing that or hearing that, you can go back and check it out in a couple of days. It'll be on the website. Now I want to turn attention to Christy and Prentice. So you had your experience with telemedicine. I just had my experience with telemedicine. What'd you think?
Yeah, it was much like an online appointment, much like a regular appointment. I prepared the same. I got all my questions answered. She was able to do an exam just like pretty much we do in the office. So it was very good. I left the appointment feeling like I had a regular appointment.
Prentice, how was it for you?
I would say it was also like a regular appointment. And Christy and I, we always like to prepare ahead of time. And I could just definitely tell that, there was the same type of experience as in office, even through the online experience. And so Dr. Martin did a really good job of making sure we had that same experience too as well.
Now, how do you both prepare for your MDS appointment?
I do two things. I kind of keep a notebook of what's been going on, and just if I have any questions, if I've heard anything, maybe in the latest research I want to ask about. And then second of all, I just think back to my last appointment and think, what has changed? And so I can talk to her about what's changed from then to now.
Did you feel it was, I think the fear is that it's going to be more impersonal.
No, it was very focused, very personal, I guess, because you're seeing them face to face right there on the screen.
Yeah, I actually felt like I had my doctor's attention more because there was no other distractions around. There was no nurses coming in. There was no other patients around. He was focused on me.
Agree.
Yeah, that's really interesting. Now, Dr. Martin, what would you say are the the benefits and the good things that telemedicine does for us?
So, I mean, I think telemedicine obviously is great for, people who maybe have some difficulty traveling, or they're not allowed to drive for some reason, or maybe live from very far away. But they're great for, quick check-ins. Maybe we adjusted the medication and somebody needs to just pop in and check on, how that medication adjustment went, or maybe they're having a side effect from a medication, so we can quickly evaluate that without them having to come all the way in. And it's great for just routine follow-up appointments, checking in, seeing how things are going, just kind of like the one we did here. And for on the physician side of things, it's really great to see patients kind of in their own environment to get a sense of, fall hazards and maybe some other things that they're dealing with.
Well, even noticing that they were using a rolling chair when you normally would have them try to stand up on a rolling chair. And so, like, I hadn't even thought about that as being sort of a hazard. And so is that something like an OT might recommend? Maybe you don't have a rolling chair if you're trying to get up and down out of a chair a lot?
I think it's certainly something to think about, especially for maybe if somebody is a little bit more likely to fall or a little more unsteady. Those are the types of things we can think about to reduce that risk of falling.
And you wouldn't know that if you didn't have a camera in their house like that.
Absolutely.
Yeah, that's pretty cool. Now, you heard us talking about how there's a feeling like I thought I had more focus and attention from my neurologist through the telemedicine session. Is that perception or is that reality, do you think?
I think it's probably a little bit of both. I think like you were saying, there's not as much distraction. You don't have the nurses coming in. You don't have patients coming in and out, other patients that are coming in and out of the rooms. So I think there's less distraction, but I also think because it really is focused on the literally being face-to-face, I think that gives them also the perception of you being able to really focus on somebody.
Right, that's great. Now, Dr. Dorsey, what would you say are the limitations of telemedicine?
So clearly the exam's not as good as it is in person. In some cases, the diagnosis is not certain, and so you need a more detailed exam than you can do in person. Some other things, we can't quite yet program DBS in remotely, although that's coming, and people are working on that. Sometimes you can't figure it out. You can't, especially for a new patient, you can't figure out what's going, or sometimes it's very, very complex. The symptoms that someone's are having, you just need them to come in. I think that amounts to less than 5 or 10% of cases. There are lots of advantages that we don't quite comment on. You get a much better social history on individuals when you see them in their home, in their natural environment. So you get lots of insights that I think more than offset the limitations.
What about like Botox injections? How can that be overcome?
Not yet, but you should. I think we should be thinking about not just telemedicine, but perhaps house calls for some of these things for Botox injections. One of our colleagues, Dr. Joy Fleischer, has pioneered doing house calls for individuals with Parkinson's disease, in which physicians or nurses or fellows go into people's homes with Parkinson's disease and provide care directly to them in their natural environment.
Now, what if it's your first time and you're trying to get a diagnosis and you're trying to sign up with an NDS? Is it possible to have your first appointment through telemedicine?
I think so. Dr. James Parkinson described the condition in 1817 that now bears his name, and he largely did that by observation. He didn't even examine 3 of the people that he described in his essay. Dr. William Osler in the late 1800s said that when well characterized, Parkinson's disease can be diagnosed at a glance. Sometimes the diagnosis is really straightforward. If someone's got 60 years old and's got an asymmetric rest tremor, it gets pretty clear pretty quickly what they likely have. Again, for some cases it's not so clear. In those cases we can always ask people to come in to see us, or maybe in the future we can go see them in their home.
Now, I'm guessing you're probably getting a lot of phone calls from people who've not done, doctors who've not done telemedicine before. What advice are you doling out the most these days on how to make the most of it?
Well, fortunately, like Dr. Martin, we had created videos that demonstrate how to do the exam, and we're trying to get the information out. My colleague, Dr. Chris Tiroli, has done a lot of work with the American Academy of Neurology and with Dr. Martin to educate clinicians on how to do telemedicine. It's not that complicated, to be honest. And I think people, once they start doing it, most people find out that they like it, and most people find out that they can form very personal and meaningful relationships with their patients.
Dr. Martin, how will my doctor approach adjustments to my medication remotely? Like, even if it's like a new medication or whatever.
So, just like we did in the video, it's really understanding, what the concerns are, what the issues are, and most of the time, even in person, we're making adjustments in medication based on the history, not necessarily that specific exam at that moment. So, just really understanding why medications are not working, when they're not working, and that can usually, give us what we need to do the adjustments.
So if somebody usually takes their parent to their doctor appointment, but now they're not visiting her at home because of social distancing, how can they still be involved in telemedicine care?
So I think that's one of the greatest things about it is, even if whether they're normally involved in their care or even if they live states away, when we do the telemedicine appointments, we can send invites to family members or other, care partners to be able to log on and be part of the visit no matter where they are.
Okay. But is my doctor's office staffed during the quarantine to provide support for prior authorization needed for certain medications?
So, most doctor's offices, even if people are not actually in the office, there's still staff working from home and working virtually to continue to do medication refills and work on prior authorizations or any insurance issues.
Okay, great. Now, if somebody can't see a doctor virtually, you can talk to your doctor about the best times to visit and the ways to minimize your risk at this time. Let's have an open discussion here about how to make the most of these appointments. Dr. Martin and Brooks and Prentice and Dr. Dorsey, let's sort of collaborate here on what we should do to prepare, and then we'll go from there. So for any doctor's appointment, but for a telemedicine appointment, what should the patient do to prepare for that? Now, let's start with Dr. Dorsey.
I think what these tips are all right, are all correct. I don't think they're fundamentally different than a traditional appointment. I think the key thing is that people should demand to be seen on their terms. In the United States, most people, again, have Medicare, and most people have paid into the program for 50 years. The purpose of Medicare is to guarantee access to health care. People should demand that they have access to physicians regardless of who they are and where they live. And I think we're seeing the benefits of it in the COVID pandemic, and we should demand that these programs stay in place after the fact.
Dr. Martin, Prentice and Christy talked about how they sort of keep track of some of the issues. How many issues do you want to hear about? What do you want to know when you meet with somebody through telemedicine?
Obviously we want to hear about the most important issues for the patient and their family, and obviously any safety concerns. But depending upon the time that's available, we usually try to limit it to maybe the top 3 concerns for that visit, so we can really make sure we spend enough time addressing those appropriately.
Now, is it helpful for us to have our bottles of medication on the counter right there so you can see them on the camera?
I think absolutely it's great to have the bottles or at least a list of medications that you're on, but a lot of times it's helpful to know, how many times a day you're taking it, or, sometimes there's a combination of medications, so it's very helpful. And we can also make sure we know how many refills are left if this is perhaps the first time we're seeing a patient.
Now Prentice, this one's for you. You go to every one of the appointments. What do you think that does? How does that help?
Well, it helps me to make sure that I'm understanding, what actually is going on with Christy and what the doctor is seeing. I always appreciate when the doctor asks me, what do I see, what do I observe, and what questions do I have. And Christy and I, we talk about that before we go to the appointment anyway. She always asks me, what questions do you have before we go to the appointment, and we share those, before we go. But just the fact that, as a care partner, when the doctor is asking my perspective, I think is important, because then it shows that, my point of view is also important as being a care partner involved in the treatment plan for Christy.
Yeah, and I wonder if, as Christy's talking to the neurologist and she says something that you think maybe you have a different perspective on, does that ever happen where she say something you're like, well, not quite?
Yes, that has happened a couple of times.
Yeah, good. I'm glad I'm not the only one. And Christy, for you, what's it? Go ahead.
I was going to say, I think it's important too to feel comfortable sharing that perspective too, because the doctor is asking, your observation, and it's important that you do share that in the context of what the doctor is asking about.
And Christy, for you, how valuable is it to have Prentice there?
Oh, it's really valuable because, he's part of it, right? I think that we all know that not only one person gets Parkinson's, the whole family kind of gets Parkinson's. And so I feel like he's vested in helping me with this disease and as we go forward, what may present itself. So it's very helpful.
Great. Now, Dr. Dorsey, specific to telehealth, how do we test the technology ahead of time? Is there a special program we got to download? Like, is there like a 50-page explainer on how it's like building an IKEA desk. I got to put something together on my computer. Like, how's this work?
For us, it works relatively easy. We use video conferencing software from Zoom. Many people have gotten really familiar with Zoom fast. We email a link to the patient, and they can download it on their desktop, their laptop, their tablet, or their phone. We usually do a test connection with one of our research assistants or clinical coordinators, and then once they have them set up, we see them. In addition to thinking about this for care, we should also be thinking that the same approach could work for clinical research and clinical trials, and that will, again, enable anyone anywhere to participate in research and make care and research more accessible to people on their terms.
What about security? We've been hearing a lot of issues with Zoom. I got Zoom bombed over the weekend.
I haven't had that yet.
Oh, you're lucky.
But I think when we've asked people, patients, and again, people will have their own opinions, people are far more interested in getting care on their terms than they are on security. One patient even said, I don't care what you do, as long as you care for me, you can put me on YouTube. Now, we shouldn't be flippant about privacy, and we should be protective of it, but we got to realize most people don't get care. Most people, don't know what a Parkinson's specialist is. Most people aren't seeing a neurologist of any kind. So we need to really think about this as a way to provide care, especially to people who have the greatest need and often the least access.
Dr. Martin.
And I'll add in, Larry.
Yeah. Go ahead.
Okay, I was just going to add in, a lot of the platforms like Zoom do have the option of having a password-protected session, or there's, kind of a virtual waiting room where, as a physician, you can kind of invite that person, only that person into the room. So there are protective measures that are available to prevent, things like the Zoom bombing. But to get to your point, so how do you kind of set up in advance? Ideally, you want to have lighting in front of you or maybe off to the side. You really don't want it from behind to kind of backlights you, and then your face is dark. So you want some lighting from the front or the side. Reduce the noise in the background. So turn the TV off, turn the radio off. Ideally, if you can, put the kids and the pets away to reduce some distractions, that's helpful. Specifically in Parkinson's, it's great to have an area where you can, actually walk up and down so that somebody can actually see you walk, especially, maybe more than just a few steps, maybe, 10, 12 steps in each direction, so we can get a sense of that. And it would be great if there's somebody that's there with you, having a care partner or just somebody else in the room to either hold a device if you're using maybe an iPad or a tablet or a phone, or to just help out maybe if you need some assistance with standing or maybe a little support when you're walking. That can be very beneficial as well.
Yeah, and I know the first time I tried to connect with my neurologist online, we had some technical issues, and we texted each other, and he goes, I'm going to send you another code, because he was just learning it. So I think we all need to also be very patient with ourselves as we go through this process, is trying to figure this out, because it's not necessarily going to be perfect, especially straight out of the gate.
Absolutely. And just like you said, having the ability to text back and forth ahead of time, or just, to be able to talk by phone ahead of time, or if for whatever reason something goes wrong and you can't do the video visit, you can still have a telephone visit.
And then, just like a regular appointment, people leave with sort of a game plan on how to move forward. So it should be no different than if you were to see somebody in person, correct?
Yeah, absolutely. I tend to type up a little summary of what was discussed for the day, so that I can always refer back to it. Our staff can refer back to it, and then the patient always has a copy. And if they lose a copy, or sort of the dog eats your homework, you always have another copy that's available, and we're all on the same page as far as what was discussed.
Now, as far as medical exams go, like blood pressure, weighing somebody, getting blood tests, how does that happen?
So, it depends. Sometimes it can be done via telemedicine. So if you do have any medical supplies, maybe you have a thermometer at home, or maybe you have a blood pressure cuff or your scale, you can use those. Sometimes patients can just record it, before they come on, and just give us that information, or they can actually, test it while they're on screen, so we can actually see it. So those things can certainly be helpful. Obviously, if you're tracking information between visits, sometimes having trends and understanding, my blood pressure always drops, in the morning after I take my first dose, or something like that, can be helpful as well.
Great. Now, Christy and Prentice, I want to know, if you had a choice, would you want in-person or would you want telemedicine?
I think it depends upon appointment, but for just a regular checkup appointment like we did with Dr. Martin, I'm very comfortable just doing it online. It's so convenient, not having to go into the office, just pulling up to my computer and just logging on. It's so convenient, and I get the same outcome. So I'm really comfortable with that.
My perspective is that have both options. And, I've had telemedicine visits. As a matter of fact, I have one coming up here in a couple of weeks. And it's just something that we all need to get comfortable with. And I think it's very valuable going forward.
Oh, that's great. And then we're going to get to some Q&A here in just a minute here, but I do want to take a look at some additional resources that the Michael J. Fox Foundation have made available. You can go to michaeljfox.org, look for movement disorder specialists in your area using the MDS finder, so michaeljfox.org/MDS. You can visit Ask the MD for expert tips and advice from our own movement disorder specialist, Dr. Rachel Dolan. You can view webinars on demand anytime at michaeljfox.org/webinars. You can read guides for living well with Parkinson's and participate in research. FoxInsight.org is an online clinical study you can join from home. And you can save it and they come back to it later. Like, you don't have to do it all at once. It's super convenient. It's easy. If you've not signed up for FoxInsight.org, I tell you, that's the easiest way to participate in research and really help make a difference in the future of Parkinson's. So once again, we want to thank all the members of the Parkinson's Disease Education Consortium for making these programs possible. This is really amazing. Dr. Martin, do you think telemedicine will continue after coronavirus?
I think absolutely. It was already a growing field as it was, and I think this has just given us the push to kind of make a paradigm shift in how we're delivering care. And we're really hoping that we've made some pretty big bounds forward, and we're hoping that there may be some tightening of the restrictions, but as Dr. Dorsey said before, I think at this point the genie's out of the bag, and now that people have experienced this care and understand the benefits of it, we're hoping it'll continue going forward.
Dr. Dorsey, have you done any research or seen any research that's been done comparing patient outcomes from telemedicine versus traditional care?
Yeah, so we did a national randomized controlled trial of telemedicine versus usual care about 5 years ago. We found that it was feasible, that over 90% of people could connect to their telemedicine appointment. We showed that the clinical outcomes were comparable between the two groups. We showed that each visit saved patients and their caregivers 3 hours of time and 100 miles of travel per visit. We showed that people were overwhelmingly satisfied with 3 of the C's: care, convenience, and comfort. And we even showed at the end of the study that people across many dimensions generally, but not always and not universally, preferred telemedicine to in-person care.
Now, as people advance in their Parkinson's, I know cognitive issues and dementia can be an issue. How do you help them have a good appointment if they are required to do telemedicine?
Again, it goes around to designing care around people's needs. We know that Parkinson's affects mobility. We know that impairs driving ability. Yet before COVID, we somehow insisted on patients driving to see us with their overburdened caregivers to cognitively complex and physically challenging environments to receive care. There are a lot of people with advanced Parkinson's that never make their way into a clinic. There are tens of thousands of people who are homebound with Parkinson's disease who never see the light from a Parkinson's specialist. We need to think about ways that we provide care to people on their terms and recognize that there are a lot of people suffering with advanced Parkinson's disease and with Parkinson's disease generally that just have few resources for which to help alleviate their suffering.
Dr. Martin, if I'm having new symptoms and I think I need a new medication, is telemedicine really the best way to do that? Because traditionally I'd want to go see my doctor and have them make sure that they're seeing what I'm seeing and they can talk to me about the medication. And is that an issue to start a new medication via telemedicine?
I think it obviously depends on what exactly the complaint is, but there's certain complaints that somebody may have that maybe they're having a side effect of a medication, or maybe they're having some difficulty sleeping, or they're acting out in their dreams at night, or something like that, where the exam isn't going to change our management of that. And so I think in those cases we can absolutely consider starting a new medication via telemedicine.
This one's for Dr. Dorsey. How popular does this have to become to really have an impact on the consumer's healthcare costs in a positive way?
Telemedicine will be modestly cost savings because if we create incentives to provide care to patients on their terms, that's generally less expensive than providing care in expensive institutions that have parking lots and waiting rooms. It'll have modest savings. Parkinson's as a whole is expensive. The Michael J. Fox Foundation just did a recent study that found that over 1 million Americans have Parkinson's disease. 2, the total economic cost of Parkinson's is about $50 billion a year. Half of that's in healthcare expenditures and half in non-healthcare expenditures, disability due to work, caregiver time.
All right, here's one for either one of the docs. I've got a care team. I've got a PT, a physical therapist. I have a occupational therapist. I've got a speech therapist. I have my pharmacist, and I've got you. Can I get you all on the Zoom call at one time? Have you done that?
I don't think you can get us all on the Zoom call at one. I'm sorry, Jamie, you go first, Jamie.
No, you can go ahead. I think you're getting ready to say what I am. So.
I don't think you can get us all on the Zoom call at once, but I think the nice thing is you can actually get us all. It may be separate appointments, and so now you're going to be able with telemedicine to be able to see a physical therapist, an occupational therapist, a dietitian, a nutritionist, exercise coach, and see them all separately. You're going to be able to do that via telemedicine.
Yeah, I agree. I think it's hard to nail everybody down at the same time. Although you may be able to get 2 of your providers maybe on at one time just to check on something. But I think Dr. Dorsey made a good point that you may now actually have access to all of these people. You may actually have access to a speech therapist that specializes in Parkinson's disease, or you may have access to a nutritionist who you may not have had in your area before. So I think it really opens the door for the access to that. And, we as part of your care team can continue to share our notes and our questions and our thoughts about, what would be the best next step in care.
But I want you all on the Zoom call at once.
We've done a little bit. Go ahead, Jamie.
I was going to say, there are, I don't think it's been done yet virtually, but there are a lot of places that do comprehensive care clinics where you actually will see all of these providers in a 1 or 2 day period. So it's conceivable that maybe going forward, you may actually have these sort of virtual comprehensive care clinics.
Now, this is, burgeoning in the U.S. I'm in Canada, in Vancouver. We're starting to see more of it here. Is the telemedicine that I'm receiving, that you're doing, and that's happening in Europe, is it all the same style and type, or is it different from country to country? Do you know?
So I can answer at least some of this. So, I'm on the International Movement Disorder Society Telemedicine Study Group or Task Force, and we all work together to try to have standards as far as, what we're doing in each of the different countries. Canada is great. Dr. Gutman up there really has a nationwide network that he works with to deliver excellent care. So, there may be differences in what is covered and some of the legal regulations. There may be differences in, internet speeds and what kind of access people have as far as, what devices they have. But the physicians and I think the quality of the exams and the care is the same, and the standards are the same across the board.
Okay, great. You mentioned this a little bit earlier, Dr. Dorsey, but I want to revisit it. If somebody's had DBS, can the DBS appointment be via telemedicine?
I'm not a DBS expert, but I think I think right now most people are comfortable having that done in person. But I think COVID changes everything. The idea that we're going to ask people who tend to be older with chronic conditions to come into healthcare facilities where they have a risk of getting exposed, I think that's going to change the way we do it. I think some of these things can be done remotely, even the initial evaluations. Obviously, the surgery and the initial programming need to be done in person, but I think follow-up visits for years after the fact will increasingly be able to do that remotely. We still need some technological advances, but we're working on them.
So I know that we've all, go ahead.
I was just going to say, and if we give a quick plug for our book called Ending Parkinson's Disease, which discusses some of these new technologies.
Yeah, well, it's a great book. It's a great read. Ending Parkinson's Disease is new. It's in wherever you buy books. It's great. Thank you for collaborating on that. It's an awesome book. How would so this is a great question, because a lot of us can relate to this. Going to the doctor's office and being in the waiting room, and then being in the waiting room, and then being in the waiting room, being in the waiting room, because the first appointment of the day ran long, and now I'm the 10th appointment, so now I'm a half hour or 45 minutes later than I thought it was going to be. How does that work on the telemedicine? Like if I've got an appointment at 9:30, but you're running over, what happens?
So I think, it's the same idea. Obviously, sometimes the early appointments may run over because, maybe there's a medical issue, but sometimes it's because people are running late because of work traffic. And so I think sometimes you're less likely to run late because it's kind of hard to show up late to to a virtual appointment. But, there are ways to communicate whether, you're running behind, and certain platforms allow patients to kind of sit in a virtual waiting room, and so it'll let them know, if the physician is running behind, or there may be ways to communicate, I'm running about 10 minutes behind, which I think if you're already on the computer is probably easier to do than if you're sitting in a clinic room. It's hard to run out and say, I'm running late, because that takes extra time versus just sending a quick message.
I wasn't trying to make you feel bad. We all bring our iPads or magazines. We're fine. We know the routine. It's different. When you're in a virtual waiting room, you're like, oh. So that's interesting. So if a partner, like let's say Prentice, wants to talk to you discreetly, and he can't pull you aside because it's a virtual appointment, how can he relay some information that may be more sensitive that he doesn't want to know that he's telling you, like maybe Christy's having hallucinations, or or she has some dementia that she's not really aware of? How can he get you that information?
Jamie?
Okay, I think it's I think it's the same way that we do it now. You can send messages ahead of time, so we kind of know ahead of time going into the appointment what the concerns are, and we may be able to find delicate ways to sort of address that or assess that. We can set up another meeting time sometime afterwards. You can do it by video. You can do it by phone. I think there's just basically the same ways that we do it now.
Yeah, Christy and Prentice, if somebody is just sort of tentative with technology and with the idea of seeing a doctor on a computer screen, what would you tell them? What advice would you give them as they plow forward in this new world?
I think you just have to try it. You have to kind of go beyond your comfort zone on it and just try it once and work through how it will kind of seem awkward and it may seem hard to get online to click in where you need to click in. But if you follow the guidelines as far as like setting up your room correctly, not being distracted, the doctor really knows how to do it. They will totally take you. Like Dr. Martin was amazing on our interview that we did earlier, and she took us right through the appointment. And you didn't even realize that you weren't in the appointment. You felt like you were just in the appointment.
That's
so
great.
I just encourage everyone
Prentice,
to
try
it. Yeah.
I would just add that. I would just add that there's probably someone in their family, like a younger person, that is willing to work, with the patient to help them understand how to use it and how to practice it. An example we had in our family is that we've set our mom up so that we can have video conference calls with her every week. And so by doing that, she's become much more comfortable in this environment. And I know that she could actually do the telemedicine experiences right now because she's very comfortable with the technology.
That's great. That's great. Dr. Dorsey, what about HIPAA compliance? Are you recording these sessions? How's that work?
We generally don't record them because if you record them, they become part of the permanent medical record. Then you have to figure out how to store them, and it can get complicated. But otherwise, we generally have people fill out a waiver. We also generally have people fill out a consent form that indicates to them that we're doing this via telemedicine and that the exam is not as good as is in person, that you always have the option to come in and be seen in person should you desire it.
Great. Well, thank you all. Just to note, Michael J. Fox Foundation Public Policy Team will be working in coalition with other organizations to make telemedicine changes permanent. You can also get involved in advocacy. You can visit advocatemichaeljfox.org to take action. We hope you found this session helpful. This is the first of several virtual Parkinson's IQ plus U or PDIQ sessions that we were planning, and we hope you'll be able to join us for those. You can use the hashtag Parkinson's IQ on social media to tag these events. If you want to talk about them online, visit the Foundation's website at michaeljfox.org for more information on upcoming sessions. Thank you to Dr. Dorsey, Dr. Martin, Christy, Prentice. Also, thanks to Rachel Dolan for really sharing her knowledge and information with me in preparation for the event. And thank you for being here. Keep learning, keep laughing, keep moving. We'll talk to you next time. You have a great day.